Hi, this video is the art of hair transplant restoration surgery on a client who is a class 5 hair loss pattern 4-5. He has some vellus hair here, but it's on the way out. In a few years, all this hair will be gone. And it's a good time to do, because while you have some hair, when you rebuild the whole thing, the change is not too drastic, and it reduces the chance of visibility. But you don't want to wait until you completely lose all your hair and get something done. That's when people, say, hey, last year you didn't have any hair, and then suddenly, voila, you have full set of hair. So with this, some hair, even though it's thinning, it's a very good time to redo it. We do at least 4,500 grafts, depending how many more grafts we need to do, and from the front toward the back. Hair transplant is an art form, require not more than just the surgical skill of the surgeons. Require the artistic and aesthetic detail to ensure a very natural result. Not everybody going to have a exact hairline, so you cannot make one hairline for every individual. So from the eyebrow to the hairline for Asian and black, around 6.5 to 7 centimeter. For Caucasian, is around 7.5 to 8.5 centimeter. For this client, is somewhere around 7.5 centimeter. Although we use the average height, ethnic average height as a guide, but really not everybody going to fall exactly within the average height hairline. Some of them is a little bit vary in the higher, or some a little bit lower. The most important thing is overall proportional from the eyebrow to the hairline is a third, from the microlabella to the tip of the nose a third, tip of the nose to bottom chin is a third. And then the more narrow the face, the more arched back the hairline, the more round the face, the more flat the hairline. Once we get the shape down, we zigzag through. Now, the interesting thing about this client is that not only that he loses his hair front toward the back, but his temple has gone sideways too. And we had to bring in the temple, because if we lower the hairline without bringing the temple, you have a really wide forehead, and that will look very abnormal. If I'm going to turn this way, you can see his temple starts to have a straight, and we always have what they call our temple triangle peak, and so we try to get back. And he has quite a bit of baby hair here, and we follow that, and from the midpoint to the sides around 7 to 8.5 centimeter, and this is roughly around 8.5 centimeter. And again, the Caucasian is most acute pointed backward, Asian is less acute, and black will be perpendicular. For women, actually the temple point toward the middle. And again, we try not to change the angle. We just copy where it was before here at the same angle and bring it back in. And once we get the shape down. And then once we get the shape down, we will bring a precise angle. Transplant start 35, 45 in front. Increases when you go backward and changes when you go a different direction. So the precise angle is important. Then selection of hair grafts is important. We transplant rows and rows of single hair graft in the front, followed by root of 2 hair, 3 hair, 4 hair in the back for broken volume. So I'm very excited for this client, because in a year time, his look will completely change. He will look younger, and once you have the lower hairline frame the face and bring in the temple, it really enhance your eyes, your nose, and all the features that God created for you. So it bring your look back and bring your youth back. And with that, some have improved. Some reported that have improving their self-esteem and self-confidence. And the transplanted hair, it takes a year for it to fully grow. 4 months it might begin to grow something, but I don't expect anything. When it begins, it may be 1 or 2 hair. 1 year for full result. Thank you.